I get to talk about basically one of my favorite things, one of my passions in life, and explain it to you guys. So I'm really, really excited about it. Like I said, I'm Dr. Clint. Dr. Boo, if you want to come on up here. Dr. Boo is another one of our doctors here in the office. The third one is Dr. Kelly. Now, from time to time, you may end up seeing one of the other doctors. All right, just straight. Who's patients here right now? Just so I know who we're talking about. 1, 2, 3. Okay, yep. And then, so that means the other 3 of you guys are guests. So welcome. All right, you guys are going to get a lot of good information tonight. So from time to time, you may come in and be seen by one of the other doctors. What I ask of you is you're going to have your favorites probably, but try not to get personality confused with results, because all of us here are here for one reason, is to get you guys healthy and get you guys better. Thanks, Dr. Boo. So let's kind of go through what we're going to talk about tonight, right? Why are we all here? We are going to talk about health, right? What is health? We're going to get a definition to it, get something out there. Right? We're going to talk about where does it come from, how to get it, how to find it when you need it, and how to get the most out of your care, right? How not to mess everything up. We're also going to talk about difference in healthcare models, right? Talk about traumas and stress and spinal neglect and how it can lead to poor health, all right? Poor health, not just I hurt here or I hurt here, but how it can affect your overall health. Here we go. Quality information for quality decision making, right? That's really, really important. Now, I'm going to pause here for a second, because tonight's class, I'm going to take you guys out of your comfort zone, possibly. I'm going to take you guys to the limit, expand your concepts on healthcare, right? Is it okay that I do that? Can I take you guys out there? All right, good. I love it, all right? So while I'm up here, this, believe it or not, means a whole lot to me, all right? Little head nods, you know. If I talk and I say something a little goofy or a little corny or something, a little courtesy laugh might help, all right? You guys already got the hang of it. That's awesome. Cool. All right, so we're going to get a lot done here tonight. I'm going to start off tonight with a story. This story is about me. When I was growing up, there was a man in my life, extremely influential in my life. Got a lot of my character, my integrity, my humor, all that kind of stuff for this guy. And once I hit about 7th grade, he started getting sick. Now, this was, well, it was a stomach issue. He would eat and it would hurt. He'd get sick, like physically sick. So, like everyone else, he went to the doctor, right? Figure out what's wrong with me. Well, the doctor didn't really have any idea. He prescribed me a few medications, and well, it turns out that it didn't help. So, went to another doctor. Well, the next doctor, ran some tests, gave him some medications, didn't help. Went to another doctor, ran some more tests, did a couple surgeries, didn't help. This went on for about 3 years. When I was a freshman, sophomore in high school now, this guy had progressed to the point where he was having trouble getting out of bed even. All right. Now, he had a wife. He had a son that was my age. And then he had a daughter that was a little younger. And here, this stomach problem was controlling his life. He was having trouble at work. He was having trouble with his family. It was interfering with everything in his life. At some point along about this 3-year marker, he was out and a lady approached him and said, you know what, you probably should go see my chiropractor. And his first thought, honestly, was, I got a belly problem, guys. You know, it's not a back problem. You know, what's this chiropractor going to do for me? And she goes, I don't know. I honestly have no clue, but, you know, sitting in the waiting room, I heard him talk to other people, and I have a feeling he might be able to help. Well, he didn't run to the chiropractor. It took some time still. But I remember the evening really, really, really well, where he was in bed and I was sitting beside him. And we brought this chiropractor up. And after we talked about it some, we finally decided that, what's it going to hurt? Okay. We were literally watching this guy die very, very slowly. And it got to the point where, what's it going to hurt? All right. So we set the appointment up, went in, started a care plan with this guy. And 3 weeks into his care plan was the last time we spent all day in bed. 3 weeks, and this guy was already improving. But wait, that's a back doc, not a belly doc. All right. Fast forward many, many, many years, and I was talking to him. And the reason why I tell this story to you guys is that I got into this for him. For this reason is 3 years, no answers. That's why I'm here. This is what drives me. This is what my passion is. So I was having lunch with this guy, and I told him, I said, I don't know if you know this or not, but the reason why I do what I do is because of you, and I wanted to take care of you for the rest of my life and your life. And he kind of chuckled because, yeah, I know. He said, I appreciate it a ton. And to this day, I still see this guy. So long today. To this day, I still see this guy. But what he said blew me away after this. He said, Clint, he said, my problem didn't start when you knew it started. He said, my problem actually started 10 years before you knew it. So all of a sudden, this 3-year problem that drove me to this, all of a sudden is a 13-year problem. And this chiropractor saved this guy's life. And it just blows me away. So I share, obviously, this story means a lot to me. And I share this with you guys so you know where we're coming from here. All right? This is us. So now that we've gotten the Meet Dr. Clint down, we're going to keep going here maybe. So let's talk about the current model of healthcare, what we all know right now. Okay? The current model of health says that if you have a symptom, then you have a problem. All right? So if you have a symptom, you're sick. Okay? Now the flip-flop of that is true as well. So it says no symptoms equal what? Healthy. Yeah. What becomes the objective? Is to remove the symptoms. Because as soon as the symptoms are gone, by default, you're healthy. All right? But there's a huge, huge, huge problem. The problem is that it's judged by how a person feels. Okay? So how many of you guys have been to the dentist? All right, good. Everyone? Good. All right. But how many of you guys have been walking in going, look, I've brushed my teeth like twice a day. I've even flossed every single day. I'm going to be good to go. And he gets in there with this little poker, and all of a sudden he finds this sore spot. All right? You didn't feel anything, but it was still there. So you can be pain-free and symptom-free, but still be unhealthy. All right? So then the flip of that goes where you can have symptoms and be healthy. The top 3 leading causes of death in the United States is heart disease, cancer, and stroke. Do you know what the early symptoms are of those guys? There's none. Okay? I was reading something just today that said heart disease, one of the leading symptoms of heart disease is death by heart attack. That is a really, really bad symptom. All right? So, again, how about pain and symptoms equal healthy? So, how do you feel in that picture? Okay? Go back to the last time you were in that position, and how did you feel? Not good. right? So if we add to this story here a little bit, all right, what if that evening you sat down and had a big old dinner, but it wasn't prepared right? And all of a sudden, by the time you get home, it's really, really, really upset in your stomach, and you find yourself in that position, okay? When you get to that point, let me ask you a question here. Do you want that bad food sitting in your stomach? No. Do you want it to sit in there overnight so it gets like absorbed into your body? No. All right. So now what you're telling me is that's healthy. Yeah. Okay. See, health is not about symptoms, guys. It's about function. It's about how well your body's functioning. If that bad food is sitting in your stomach, you want it out there as quickly as possible. Well, what's the fastest way out? Same way it came in. Yep. So your body is functioning really, really well. Now, to take that one step further, if you look up health in any dictionary out there, it says nothing about health is when you feel good. You are healthy when there's an absence of symptoms. No. All of it talks about functions. Optimal function, 100% function, wholeness. All right. So basically, health equals optimum function times innate intelligence. All right. Now, innate intelligence, I found, I've got to explain that. Have you guys heard of innate intelligence before? Yes, no, kind of, not really. Okay. You guys know what it is. You just didn't know what it's called. Innate intelligence is why you're digesting food right now. It's why your liver's working. It's why you're blinking. It's why your heart's beating. Okay. You can think innate intelligence for that. All right. So now that you know what it is, optimal function is a variable. All right. I think a lot of you guys would agree that there's a lot of people in this room right now that's not functioning really well. All right. It can go up. It can come down. But here's the cool thing about the innate intelligence. It's a constant. Do you not know how to beat your heart even before you're born? It knows how to do it. It's rolling all the time, and it doesn't change. So, kind of a quick little recap here. Health is not about symptoms, guys. It's about the function and the structures that allow that function, right? Health is your birthright. Guys, you're born healthy. You're designed to be healthy. That's a really cool concept. So, here's the real question now. What limits your body to function properly? The one variable in health. What allows that function? So, to do this, we gotta look at some anatomy, all right? And I know you guys are all really, you guys are just like, yes, anatomy, like edge of the seats and everything, I can tell. This is cool. What organ is the most important? What ones do you guys think? Heart, very important. Brain, got it. Okay. This organ, the brain, is the only organ encased in bone. There's no other bone out there, or no other organ out there that's encased in bone. Well, don't you want the most protection around the most valuable player? Yeah. Now, it controls everything. That heart, I think I heard skin too. Way, way important organs. All right, you can't survive without either one of those. But will they function? Will they do their thing if the brain's not involved? Okay. Controls everything, controls life. It is the source for innate intelligence or that inborn wisdom. It's what's telling everything to do what it's doing. So, number one is the brain. What's number two? Who's the second most important? Oh, this is a tough one. It's silence. Okay, I'll give you a clue, okay? There you go. All right, at least some of you guys are reading. That's good. The spinal cord. That's good. All right. So the spinal cord it's so important because it's going to connect the first guy to everybody else, right? The neat thing is that defense principle plays here too. It's almost completely encased in bone, right? You got to have the joints, you got to have the discs, you got to have the movement. so you can move around and bend and twist. Oh, too far. So let's break it down a little bit. When you're looking at the spine, there's three big parts. The cervical spine, which is the neck, the thoracic spine is through the mid-back, and then the lumbar spine. All right. So in all the chairs now, there's a lumbar support. You guys are familiar with the lumbar support and what it's that little bump, and what it's designed to do is support that curve in here. All right. You have 12 thoracic vertebrae that stack up, coming up through the mid-back, and then in the neck, there's 7 cervical. Now, the cervical vertebrae are pretty neat because they're designed for rotation, which is why you can look all the way over your shoulder. But when you go to twist, there's not a whole lot of twist involved. Okay? Now, if we take just one area and we're going to kind of zoom in on it, we have 2 vertebrae here, here and here. They come together and the joint sits right here. And that's what allows for that movement in there. In between the vertebrae, you have the disc, and it forms this hole where the nerve comes out. Now, if this joint gets injured, misaligned, so it's not functioning properly, do you see how easy it is to start irritating that nerve right there? Can you guys see that? Okay. Now, this nerve here, it's going to come out, and it's going to go to all the tissues, all the organs, all the muscles, everything. Okay, so as they come down the back, they'll go to their corresponding areas. So what's going to cause that misalignment? What's going to cause that joint to get damaged? Well, there's a lot of different things. Yeah, so we're looking at childhood stuff first. Sports, football, wrestling, soccer, pulling out chairs, falling off the bike, falls and tumbles. So our kids learned how to ride bikes last year. And thank goodness we haven't had any major spills yet. But they're coming. They'll be there, right? Jumping off the swings, landing funny. That's just a nasty baseball picture right there. That's just a bad one here. How about this here? How about birth? There was a study done. And the study took a whole bunch of OBGYNs. All right. And what they did was kind of hooked them up. And they wanted to see how much force they were putting on the little baby's neck during delivery. Just a normal average delivery. So they found that the average weight of an OBGYN was around 170 pounds. The average weight for a baby was right around 7 pounds. Okay? So before I tell you the results and how much force was put on there, would any of you guys go and grab whoever's little baby, doesn't matter, and carry him around like this? No, you'd be an idiot, right? Really stupid. Now, by doing this, realize that this is about 7 pounds of force on that kid's neck. All right, and no one in this room would do that. What they found out with this study was that the average normal delivery was somewhere between 70 and 90 pounds of force. Yeah, that's what I thought too when I found that out. Let me ask you this question here. Even at 70 pounds, do you think an injury could happen? Yeah, absolutely. Yeah. And that's not the forceps. That's not all the nasty extra. That's just a normal everyday delivery. 7 pounds, 70, 90. So, how about this one here? Adult injuries, falls on ice. You know, Indiana is known for its ice. You know, falls on stairs, playing sports, lifting injuries, repetitive motions. What about these things? What about these repetitive motions? School teachers stand all day. Okay, look at accountants. They're on a chair, have a mouse all day. What if you answer phones? Okay. It's these repetitive motions over and over and over. Bumps and jars to the head. How about car accidents? Okay, on this picture here, no one can deny that that guy's hurting. Okay, but what about this picture? What about this little fender bender? This little bump? what they're finding is that it's causing a delayed effect. All right, it's causing a soft tissue injury. Soft tissues are going to be muscles, ligaments, tendons, discs. That's a soft tissue. So you get on an accident in here, and the crumple zones all crumple up, the airbags deploy, and that's designed to absorb the force. And this one, the crumple zones don't crumple and the airbags don't go off. So guess what they're finding where the force goes? Right to you. Yep, and that's what's causing the injuries. Now, that's what's causing the injuries. When we start showing the films and start going through the x-rays and start explaining this stuff, one of the first questions that gets asked to me is, how did I get like this? Why is this looking the way it is? And when it boils down to it, it's a cumulative thing. It's very typically, it's not, you know what, when I was 7 years old, I fell out of a treehouse and landed on my head. And that's what started it all. Very, very rarely do I get that. So you got the 70, 90 pound pull on your neck at birth. Believe it or not, I had a third grader last year come in. Her backpack weighed 30 pounds. That's a really heavy backpack. Sports, you got anywhere from peewee to high school to college to pros. Okay, years and years. Driver's license, all right? You know what? Get your first car, it snows, it gets all icy, a couple fender benders right at first. You know, who knows? Then, this is my favorite one, because you think you have stress until you hit college and you're like, whoa. And then you get out of college and then you're really like, whoa. And you get this huge stress dumped on you. So it's usually not just on one thing. It's everything that kind of balls up into one. Kind of going back to this anatomy stuff real quick. When someone comes in through the process of our consultation and the exam, we start getting these little pictures in our heads, right? And I'm going to kind of take you through this here. If someone comes in and they have, I don't know, let's go with low back pain. They hurt their low back. The nerves in the low back are going to come down the legs. So these nerves here are going to go pain down the legs, cramping in the muscles, that kind of stuff, difficulty walking. So if someone comes in and goes, I have low back pain, a very easy question right off the bat would be, does it go down the leg? Does it hurt down the leg? Is there numbness down the leg? Because that's where the nerves go. Okay. What about up here in the neck? All these nerves come down into the hands. So the weakness in the hands and numbness in the fingers, that kind of stuff. Okay. Now, if we add the rest of the picture, these same nerves that come down the legs and are going to be responsible for the ache in the legs are also going to come out here and go into the large intestine or small intestine, kidney, and bladder. So, if these nerves here are dysfunctioning and you got pain down the legs, pretty easy question to ask would be, well, are you constipated? Okay. Come up a little bit and you're going to get into the stomach. Heartburn, okay, indigestion. Come up in here, this mid-back area. Heart and lungs. Now we're getting stuff like asthma, difficulty breathing, shortness of breath, heart palpitations. Yeah. Up here in the neck. Now we're going to start seeing stuff like headaches, anxiety, depression, ear infections, sinuses, sinus problems, insomnia, ADD, ADHD. All right. So when I start cueing in on these, do you guys see how they're connected? And how all of a sudden, now we went from, oh, it hurts here, to all of a sudden, it's a health problem. It's affecting your health. How do you function? I have just spent a good chunk of time on this, the subluxation. The subluxation is what chiropractors look for. Okay? It's that irritation, that damage to that joint, putting pressure on the nerve, then wherever that nerve goes is going to start having problems. So as we go through this and as we start looking at it, there's 5 things we want to find. The first one is just pain or tenderness. Does it hurt? All right. What do you think? Do you think a swollen joint hurts? Yeah, absolutely. It's going to swell. The muscles are going to tighten up to restrict the motion. Well, now you're going to have locked joints or restricted motion. You're going to have abnormal posture, abnormal heat. Okay? That's the 5 things that we look for when we look for these subluxations. Now, the subluxation over many years has been attacked. It's not real, it doesn't exist, you guys are making it up. Well, the neat thing about that is that technology is catching up to what we've been saying, right? They've now got these functional MRIs, these functional x-rays. You can stand there and watch how everything moves and how everything flows, right? So the University of Colorado, there's a Dr. Sue. He's a spinal expert, not a chiropractor, guys. He's a spinal expert, right? He's done a ton of research on this thing. He published a few things, and then this was part of it. He said, subluxations are very real. We have documented it to the extent that no one can dispute its existence. Guys, let me stop with that just for a second, because that quite literally blew my mind. Because that's like me going, hey, there's a chair here, guys. It exists right here. Do any of you guys want to dispute that? You guys want to argue with me that there's a chair here? That's what he's saying about these subluxations, is no one can argue that they're there now. But he goes on. He goes on to say that the spinal nerve, a weight of a dime on a spinal nerve, can cause it to malfunction by up to 60%, can change its transmission up to 60%. That upper mid-back on that last picture, the nerves came out here, went to the heart and lungs. If you got a pressure on that nerve that goes off to your heart, do you want your heart working at 40%? And he's saying a weight of a dime can do that. That's crazy. So, the Journal of the American Medical Association, there it is, published this. It said, deviations in the body's center of gravity, which means poor posture. It's a fancy way to say it, but that's what it's saying. It says it's resulted in intestinal problems, hemorrhoids, varicose veins, osteoporosis, hip and foot deformities, poor health, decreased quality of life, and a shortened lifespan. The AMA just described a subluxation. It's right there. They're finding the same things we are. So, after we go through everything, we sit down and start to come up with these care plans. All right? This is that part where I tell you how to get the most out of your care. All right? Everyone want to hear this? This is important stuff. Oh, man, do I got to start telling some jokes or something? Wake you guys up a little bit? We're good? Okay, cool. All right. So, the first one here is putting off the problem. All right, it's like a leaky roof, guys. If you walk home, you can walk home if you want to, drive home, and you go in and you see this watermark in your ceiling. You look up there and go, I'm going to wait 2 years, and let's see if that thing gets any better. All right, what will generally happen is that. All right, now, let me ask you this. Which one of these is easier to fix? Okay. Yeah. Which one takes longer? Which one is going to cost more, guys? Okay. It's that failure to get it checked. All right. I can go out to the mall and watch people, and I can see high shoulders. I can see funky hips. I can see abnormal gait. These guys all have problems. But are they getting it checked? So, the 5 most dangerous words in the world, maybe it'll go away. All right? Because here's the thing. Common sense and reality say that something will only go away when what causes it goes away. Okay? What's causing it? All right, so keeping on going here. Covering up the problem. Okay, let's be honest, real honest. You guys could go down the street and you guys could get any pill you wanted for any symptom, for any problem. You can get if they don't have a pill, they got a cream for it. Okay? Very, very, very honest. When you do that, it's like putting duct tape over your oil light. All right, yeah, Dr. Clint, you're nuts. I know I'm nuts, guys. It's fine. But as we sit here, if you're driving off to Tennessee, Florida, whatever, okay, going on vacation, your check engine light, your oil light comes on. Okay. Who would run into Lowe's and buy a roll of duct tape and put it on there? No. Hopefully none of us would. You'd rather run into Jiffy Lube and have it checked real quick. The reason why we're not doing this, it's a very effective way to cover up that light. Right? That light's no longer a problem. Right? But we don't do it because we know that light's just a symptom of the motor having a difficulty. Right? And if we do that, then at some point the motor is going to seize up, it's going to fall, it's going to die out. Now, what if you're having knee pain and you take this Advil, aspirin, cover up the pain? Did that little pill do anything for the function of the knee? So the problem still exists, right? What's going to happen to the knee over time? It's going to seize up, it's going to fall apart, it's going to die. Okay. Missing appointments. Okay. This one I like to refer to it as like baking a cake. Now if I have a recipe, I am not a baker, but if I have the recipe and the ingredients, I could get a cake out of it. All right? But if I'm sitting there baking and my kids start yelling at me or I get distracted or just bored and I decide, you know what, instead of 2 cups of flour, I'm going to do 1 cup of flour and I'm going to do an extra cup of sugar. Okay. And then instead of 2 eggs, I add 4. Instead of baking it for an hour, I only have 20 minutes left, so I only bake it for 20 minutes. I get something that looks like that. Now, technically, that's still a cake. Not a very pretty one, but technically it is. When you start factoring this back into the chiropractic and the care plan, when you start missing appointments and when you start, okay, I'm going to do this but not this, and we're going to do this, and just start swapping everything out, you end up with a cake like this. Technically, you're healthier than when you started, but it's not the beautiful cake that we had set out for you. Okay? Last one here. Too big of a hurry. We are in a society that there's no time to be down. You got to keep moving. I got people to feed. I got places to go. I got kids to take. It's move. Right? But Mother Nature says, nope. Your body takes a minimum of 90 days to heal. Okay. So you get pregnant. Right? You get this baby. How long does it take to have the baby? 9 months, right? Can anybody tell me why it takes 9 months to have that baby? It just does, right? It just does. You got to make it, right? It's got to develop. That's what they're saying about healing time, all right? There's no way to rush it. You can't speed it up. It takes a minimum of that 90 days to do it, all right? Principles for a healthier life. Remember, health is your birthright. This is how you were designed to be, guys. So, when you're looking at it from the very beginning, there's a mommy cell and a daddy cell, and they come together. Right? That cell starts to divide, and the neat thing is that when it divides, it's exact duplicates. It's the same thing over and over and over again until it makes this thing called a primitive streak. Now, the primitive streak later becomes a notochord and then later becomes a spinal cord. But when it forms, it starts taking over. It's going to start telling these group of cells to become lungs, these ones to become an arm and some muscles, and it starts taking over. Now, as it progresses, like I said, the notochord becomes the spinal cord, and it finally passes all the responsibility up to the brain. 9 months later, you have this perfect little baby, right? Now, that nervous system controls everything in the body. You guys know that. Digestion, lungs, everything. From that point, for the entire rest of your life, the cool thing about this is that every 7 years, you have a brand new body. Yes, right? Like, I'm hoping for that six-pack in about 7 years. That's what I'm hoping for, all right? But it doesn't quite work like that. But how it does work is, well, you guys know your skin falls off, but you never run out of skin because you just have more cells there to back it up. Well, did you guys know that your lungs do the same thing? And your heart and your liver? Everything in your body does that. As the old ones get old and die off, you just have a new one there set and ready to go, and it plugs it right back in. Now, over the course of 7 years, it's all replaced. Okay? So, constant state of cell replication. That's how you guys heal. Okay? Now, as it's going, what if the nerve that goes out to your pancreas got some pressure on it? When the brain sends that message down there, hey, cells, let's split, and they split, but because of the pressure, it gets the wrong message across. Well, now those two cells are going to be formed incorrectly. You're going to have two bad cells. Take this process and advance it 5 years, 10 years. Now all of a sudden you have a pancreas with a whole bunch of bad cells in it. Is the pancreas going to function correctly? No. So the job of the pancreas is to metabolize sugar. So if it's not functioning correctly, you're going to start getting lightheaded, you're going to start getting... So you go to the doc, and they do the blood test and go, ooh, you have diabetes. Okay. Now, what would happen if you took that nerve, released the pressure off of it, and now all of a sudden the brain can communicate correctly to that cell? Well, then it would start splitting the right way again, right? So now, as the bad ones die off and are replaced with good ones again, your pancreas actually heals. It actually fixes itself. Okay? Guys, this is how you're designed to work. All right? It sounds too easy to be true, but it's it. So let me ask you a question here. When you start, now that you know how everything functions correctly, when you're diagnosed with that diabetes and you're given the insulin for it, is the diabetes really the problem, or is it just a symptom? It's a symptom. So what's the treatment? The insulin. And what is it treating? The symptom. If you get rid of the symptom, you're healthy, according to them. But nothing is done for that problem. The problem only goes away when what causes it goes away. Find the cause. Remove the cause. Let your body heal. All right?
Now, are you saying that all maladies and diabetes, etc., are caused by subluxations? I know that the founder of chiropractic will say that.
Yeah. I got some stories later on. Yeah. So, get rid of the subluxation. It allows the body to heal itself. Right? The adjustments that we do to you guys fix the subluxation. It allows that nerve to function right. It allows the body to function as it's designed to function, as it was made to function. For those of you guys that like analogies, if Dr. Kelly goes home and plants a beautiful garden and has a hose draped across the driveway and it hooks up to a sprinkler. And the sprinkler goes off and waters her flowers, there's no problem. But if Dr. Clint comes home, parks on the hose, cuts off the water supply, her flowers start to wilt and die, right? Especially in the middle of summer. Right? So if I come out and Dr. Kelly sees that the flowers are going. She goes, Dr. Clinton, I need your help. And I said, what's up? She goes, I know you're a genius and you know everything. Yeah, thanks. There's that courtesy laugh I was looking for. Thank you. And I need your help to fix this problem. And I see that I parked on the hose and I get the car off the hose. Then all of a sudden, the flowers come back. Now, did I even touch the flowers, guys? Did I do anything to them? Innately, they know how to fix it. That's what chiropractic does. We take the pressure off your garden hose so that your flowers bloom right. Okay? Now, Journal of Neurological Science, they say that the quality of health is directly proportional to the functional capability of the central nervous system to send and receive messages. So you're only going to heal as well as you can communicate back and forth. All right? That's everything that we've been talking about, guys. The medical approach. It's a symptom relief model. It's designed to treat parts, not the whole thing. That's why when you take a medication, yes, that problem is functioning better, but it disrupts everything else. Side effects. Okay? That's why that is like that, because they look at tiny little parts. Okay? Treat the symptoms. Pharmaceuticals, it's the same thing. That's how they treat it. So it's a symptom model. Do you think there's a profit for drug companies? Well, let's go through some kind of scary things. 80% of the budget is on marketing. Did you know that the United States is one of 3 countries, I've heard, that allow drug commercials on TV? Could you imagine watching Big Brother at night and not ever seeing a drug commercial? It would blow my mind. Americans spent $3 billion on drugs. $300 billion, thank you, on drugs. Combined profit of the top 10 Fortune 500 pharmaceutical companies, $35.9 billion. Americans, here it is. We're number 79 out of 81 countries on the total health index. That means there's 2 countries sicker than us, guys. Yet, $2.7 trillion on healthcare alone. We spend more money than any other country in the world, but we're literally one of the sickest. Insurance. Insurance goes the same route. It's a symptom-based philosophy. Okay? If we want to be in network with an insurance company, they make us sign something that we agree that we'll do the least amount that we can on you in the shortest possible time at the cheapest price. They want us to get you in and get you out and be done with you guys. That's what we have to sign and agree for. Now, when I think of this, I think of a garage, a mechanic. Okay, and I think, am I going to take my car to the guy that's going to do the least amount he will on the car, spend the least amount of time and use the cheapest parts on that car? And the answer is no. There's no way I'd do it. Take my car to a mechanic like that. In Chicago, whoops, too far. It's kind of stalling. In Chicago, there was a gentleman, and he got into an accident and really, really damaged his leg. Right? And when he got to the hospital, this happened to be a team of surgeons there they said that they could fix it. They could save his leg. And it's going to take, I can't remember how many surgeries and everything. And so when they called his insurance company said, no, we're not going to pay that much for it. Amputate it and we'll pay it. So I could not imagine being this doc, going to this guy, saying, here's your options. Pay for it, you can have your leg. Insurance will pay for it, we got to cut it off. Well, this case went to the Supreme Court because he couldn't afford it. The guy lost his leg. And so it went all the way up to the Supreme Court. Guys, this is why I'm not going to do the cheapest work on you guys. The purpose of chiropractic, remove interference, guys. Get that interference out of there. When it's out, it allows for that nervous system to communicate properly. Back and forth, back and forth. When you've got that communication, the cells are going to replicate better. We talked about that and how that is how you heal. All right? When you start healing, you're going to function better, which is the function model that we talked about. Well, if you got good function and innate's a constant, then you're going to have your health back. Case studies. I'm going to go through a few studies here. This will kind of start answering your question. All right. These guys were all from here. So this first one here is, we got some lag going tonight, I apologize. Oh, it's more than lag. There you go. All right. So this first guy here, Mr. Headache. This guy originally came to me for headaches, right? When he showed up to my office, he had 6 headaches a week, and one day that was okay. Now, his story started 5 years before he met me, where it was a daily headache. He had went to a couple different medical docs. They gave him drugs. They didn't help, plus he didn't like the way he felt. So he tried to find a different route. So he went and he found a massage therapist. She would give him the massage. It would stop the headache and it would last a day. And that's the way he got the good day. Well, he came to me and we started with acupuncture first, actually. And over the course of a few weeks, we were able to get 2 good days out of it. But he still had 5 days of headaches. And I wasn't satisfied with it. He was thrilled. I wasn't real happy. So I finally said, we gotta get some pictures. I gotta look at this because this isn't right. You're not born to have headaches. So this is the first picture we got. Now these are both neck pictures. He's facing that way. As it curves up here, there's the normal textbook line, and he swings out here. Now he also has 2 disc wedges down here in the lower neck. All right. Guess what he didn't tell me about? Numbness. Okay, numbness in the hands. Okay, numbness in the hands. As we took the measure here, we found him to be 32 millimeters off of normal. Right. 4 weeks later, we took this picture. He went from 32 down to 29. Okay. Also, look at these discs. Nice and big. Okay. His hand numbness was gone. Okay. But 32 to 29 doesn't seem like a huge change, does it? When you're talking millimeters. In between these 2 pictures, we went from 2 good days to 2 bad days. We were able to get enough pressure off those nerves to start freeing it up. Now, this guy has continued with me, and I've seen him for almost 2 years now, 2.5 years. I see him every 3rd week. All right. He'll come in and go, yeah, I had a headache. So now we went from, he has a minor headache about once a month. So big life-changing experience for him. Very, very cool. This lady here, this is one of Dr. Kelly's. She has Crohn's disease. You guys know what Crohn's disease is? Basically, you get sores in your large intestine, small intestine. All right. So you can just imagine when you eat how that feels. All right. Disc wedge right here between L3 and L4. I know you just saw it not too like 45 minutes ago, but you guys remember where the nerve in that low back goes? It goes out to that large intestine, small intestine, right? Okay. So 22 milliliters down to 16 1 month later, and that disc wedge is gone. It's a normal, healthy disc all of a sudden. This lady went from a handful of pills every day down to about half of it in 4 weeks. This lady has been with Dr. Kelly for about a year now, and she leads a normal life. No pills, eats like everyone else, doesn't have to watch her diet. Mr. Knee Pain, this guy is a really cool story. Retired guy, all right, love this guy. He started with me here. He got a job, he's retired, he got a little job at a fruit market. He loves people, he loves outdoors, it's close to his house, I love it, that's what I want to do. Well, he came to me ready to quit because his knees hurt so bad. He couldn't stand on them, he couldn't lift, he couldn't do anything. This picture here, we took 4 weeks later. When you look at the discs, that one is almost touching, almost that bone on bone in the back. Okay? Huge wedge. This one is getting really, really bad. They're still wedged, but there's a huge difference. Would you agree? That was right in the middle of summer, and he would come in going, I moved 300 watermelons today, but my knees hurt a little. I thought, okay, let's do it. Let's deal with that. So we'd get him adjusted, and we kept him at work. This last picture was at the end of, I think his plan was 120 days, his whole plan. Okay. If you look at these discs, every single one of them is blocked off. Every single one of them is perfect. That was winter time now. And he came in shortly after this picture and goes, I snowblowed 9 of my neighbors' driveways today with no problems. That's a huge, huge change. Now, let me ask you a real quick question. This is low back pictures, right? Is it a knee picture? No. Guys, I didn't touch his knees. I adjusted his low back. But where those nerves go? Right down the legs, allowing that function. Let's go to the next one here. Neck fusion. Neck fusion. Oh, let's come back here. You see the heart? There's 2 screws. There's a steel rod, stainless steel rod in the back. You guys see that? Okay. Guys, here's the normal curve right here. Look where they fuse him. Anyone else see a problem with that other than me? All right. Now, the sad thing is that's very, very, very normal. All right. This guy had the fusion, had the surgery, but guess what? Still had a ton of neck pain. All right. 46 to 42 millimeters. We're pulling that thing back. We're getting that curve back. Even with the fusion in there, we're restoring the function in the neck. He was able, it was to the point where he couldn't, he could barely drive because it hurt so bad to turn. And he was no problem at that point. All right. That's 4 weeks. This guy is still under active care with me right now. He came in. He had pain from head to toe. 18 years like this, guys. Okay. He literally said, I don't feel like a man. I don't feel like a husband. I don't feel like a dad. He works late. And there was nights that he said he would literally crawl out to his car through the parking lot, to sit at his car, to be able to get up into his car to drive home, just to wake up in the same amount of pain and start the day over again for 18 years. Depressed, anxious, constipated, shortness of breath, everything. One sick guy. They literally took all his medications away. They said, there's no way it's helping you anymore. I got you on the highest dose and it's not affecting you. We're just not going to give them to him. Suck it up, buddy. That's what they did to this guy. So he actually came in off a referral. Thank goodness. Looked at him, checked him out. Huge disc wedges. Just massive. That one's, the whole thing is collapsing down. We're getting some disc back in it. We're getting some movement back in it. This guy went fishing with his father-in-law and one of his father-in-law's buddy all day standing in a boat with no problems the other day. Like, I could not believe it. I was so happy, so happy. He's working through the night. He still gets sore if it's a real late night. He gets still sore the last couple hours, but he's not crawling out to his car. He's enjoying his family. He was working on this boat the other day. This is 4 weeks into it. I don't even have the final one yet to get it. So I'm really, really excited. Miss Leg Pain. Now, this is one of Dr. Wu's patients. She came in with some crazy leg pain, like some of the worst I've seen in a long time. Literally no curve whatsoever. There's no shock absorbance whatsoever in that back. 4 weeks later, we got this one, and we got a nice curve. I saw her here the other day, and she just walked right past me like nothing was wrong. Let's see here. Who do we got here? Scoliosis. I can speed up through some of these here. This lady is in her upper 80s. This picture, you're looking at it from the back, guys. It goes here and here. Okay. 87 years old, 88. 94 millimeters down to 71. Her final one was around 62, and we're getting ready to take her year ones coming up. Real quick here, who's older? Both females. This gal comes up a reverse. See how it's curving the wrong way? It's supposed to be curving this way. 41 millimeters. This lady has a curve 10 millimeters off. Which one's older? She's 14 years old, guys. The other one's 71 years old. 14 years old. Look at that neck. What symptoms go along with that neck? Sinus infections, hearing problems, anxiety, depression, insomnia, difficulty focusing, ADD, ADHD. Lower neck, you're going to start pulling into that heart and lungs, asthma, difficulty breathing. If nothing is done to stop this, where's her quality of life later? Last story, Diana. Diana was one of my first patients. She came in with leg pain down both legs. She was referred to me, and it was basically, hey, you got to help Diana. And I said, I'll give it a shot, see what happens. Diana came in and she was 10 years old. I was not prepared for that. The biggest concern with Mom and Diana was that it was November and she's dancing in the Nutcracker in December, and she cannot even stand right now. This gal has got to dance. And it went over and over. And I finally said, what's so important about this Nutcracker? Why did you guys have to dance in it? And she said, well, Diana has cystic fibrosis. Okay, so this is not her, and this is not even the same person, but this is lungs normal, nice and black. This is lungs with cystic fibrosis. The white is mucus. The white is snot. What happens with these people is that they breathe in, but they can't get the air out of their lungs into their body because of all the snot. It stays trapped in their lungs, or they exhale it. So, thankfully, we got her to dance, which was awesome, because the concern was that she may not be able to next year. Her health may not be there. She may not be here. Who knows what's going to happen? So we were able to get her to dance. And then the cool thing about it is I saw her for 2 more years after that, at once a month. So about 24 visits. Towards the end of it, Mom came in and said, hey, so we just got our yearly results with her cystic fibrosis. And they came back negative for cystic fibrosis. And I thought, what? Say that again. And she said, yeah, the test came back and they said she doesn't have it anymore. And so I said, well, let's repeat that test a couple times, because that's major. And we repeated it 3 times total. And none of them came back positive for cystic fibrosis. Now, I'd be a fool if I stood up here and said, hey guys, I know how to fix this. I know how to fix this because I have no clue. All right, no one does. What I know how to do is find and fix that subluxation. But you know who knew how to fix it? Diana did. Because that's your birthright. You know how to do this. If you can get everything communicating, you know how to do this. Right? Now, kind of a wrap up here. Explained how not to undo everything we're getting ready to do to you, get the most out of your care. The 90-day healing rule. Follow the recipe to get your cake. You're designed to be healthy. There's a saying that says, health doesn't come from a potion or a pill, but it comes from inside via the nervous system, from above, down, inside out. It's a cool little quote there. Now, if you guys would take a second, I do have a couple things, well, actually just one thing to fill out, all right? Feedback. Did you guys learn something? Was it cool? Was it worth it? Did I smell funny? Did I spit on you? Well, that kind of thing, okay? Dr. Vu and myself like to do presentations. We like to go out, different businesses, companies, groups, organizations, whatever. If you are a member of one of those places and think that they might like to hear some chiropractic stuff, write it down there. We'll talk to you guys about it. The last couple pages are just different articles to take home. The very last one is a picture of the spine, and it's a fun one. It goes through all the different symptoms and where the nerves go and that kind of stuff. The very, very, very bottom, there's a couple spots on there that, as I was talking, maybe someone came to your head. I wonder if they could help my Aunt Susie. That's what those spots are for. And I want to make it abundantly clear that this isn't about me. So I don't care if your Aunt Susie lives in Nevada. I will go out of my way to try to find someone in Nevada that can help her. If you think these people are sick and need to get their spines checked, to get their health checked for subluxation, that's what that spot's for. Now, if they're around here, I'll be more than happy, or Dr. Vu, whoever, to see what we can do. And if they do around here, we have a health certificate. And the health certificate is $30. It's for the consultation exam, any kind of x-rays we need, anything. Basically, if we can help them or not. To be honest, when people come up and ask me, can you help my Aunt Sue? I don't know. And I tell them that. I have no clue. Let me ask you some questions, see if it works. But I really need to see them. So that's what the health certificate's for. And basically, just thank you. Thank you for coming here. I appreciate you guys. So, take whatever time. No, don't. Yeah. I appreciate it, but yeah, take your time. Dr. Vu and I will be around here until everyone's gone. So.